We're going to deal with chapter 6 today, public health. The learning objectives define public health, its current and traditional roles, understand the differences between endemic, epidemic, and pandemic diseases, describe the history of pandemics, and describe the history of US public health service. Public health is a term used to describe efforts made by communities to cope with health problems that arise when people live in groups. Early public health strategies employed sanitation techniques to improve environmental conditions. Within the last century, sewage treatment plants, drinking water filtration, enforcement of food handling regulations, and other public health practices have helped to control the spread of diseases through the separation of sewage and drinking water. Later, public health practices attempted to control the spread of communicable diseases too. Public health officials are responsible for collecting and analyzing data to determine the epidemiology of diseases. The epidemiology is a study of the distribution and determinants of diseases in a population. Public health includes educating individuals about personal hygiene and organizing medical and nursing services for early diagnosis and disease prevention. Four tasks traditionally fall under the purview of public health officials: identifying diseases causing death or disability, understanding disease causes and transmission methods, developing prevention methods, organizing effective prevention applications. Diseases previously affected most children, and vaccines are required for school-age children. Vaccines actually required for the school-age children have nearly eradicated many diseases. Endemic. Usual sustained growth occurrence of disease in a population. These are the major epidemiological definitions which you are looking at. Epidemic is the unusual occurrence of a disease in a population, and pandemic is unusual spread of disease globally or in a larger geographic area. And whenever you hear pandemic, the first thing that comes to your mind would be COVID, right? So it was an unusual spread of disease globally. So the COVID-19 pandemic, also known as coronavirus pandemic, is a global pandemic of coronavirus disease of 2019, caused by severe acute respiratory syndrome. So there's some other major pandemics are 430 BC, Peloponnesian War, so 165 to 180 AD, Antonine Plague, 541 AD, Plague of Justinian, 1300s, the Black Death. Cholera outbreaks are 1816 to 1826, 1829 to 1851, 1852 to 1860, 1863 to 1875, 1899 to 1923. And 1918-1919 there was the Spanish flu, and also have modern day AIDS, and future potential outbreaks are again influenza, Ebola, SARS, avian flu, etc. There are three levels of public health prevention. One, primary prevention, prevents disease process from starting. Second, secondary prevention, early detection of diseases. Third, tertiary prevention, treats diseases once present to avoid complications. Public health problems are diseases or issues that may be common or increasing in a community. Incidence is the number of new cases of a disease during a specific time, while prevalence is the existing number of cases during the same period. A problem is considered a public health concern if it involves socioeconomic or other external factors beyond individual control. It becomes a public health threat if the outcome is severe, such as causing death or affecting many people, and can be actual or potential. A problem becomes a public health responsibility when it can be addressed through organized social action. The relationship between public health and private medicine should be symbiotic, functioning together for the greater good. Prevention and treatment should complement each other. However, history shows this partnership hasn't always been smooth. Public health professionals and clinicians often had a contentious relationship, not a smooth relationship. Some argue that opposition from private practitioners stems from concerns about losing patients and income, while others contend that some public health programs duplicate existing private sector programs, unnecessarily intruding in the doctor-patient relationship. So, public health versus Medicare comparison. Today, public health and Medicare overlap. 10% of the care money is spent on health promotion, disease prevention, but less than 3% in the public sector. More money is reimbursed medical care providers for preventive care than is spent on public health. Prevention is more costly in the medical sector. Public health has been associated with poor and welfareism type of thing. Public health is considered less glamorous than medical care. So this is generally when we read about US healthcare system, it is always focusing on curative aspect rather than prevention aspect. So that's, again, it is clear from the slide that we are more focusing on the curative aspect, because only 10% of the healthcare money is spent on health promotion. The relationship between public and private medicine should be symbiotic, but both working for greater good. Prevention and treatment should complement each other. However, history shows that this partnership has not always been complementary. There is a difference in evaluating performance from a medical care versus a public health perspective. Medical care perspective is focused on those treated using good care received as the numerator, and all those who sought care as the denominator. Public health perspective compares those who received care to those who need it. So the medical care performance is actually those who receive good care by those who sought public care, and while public health performance is those who receive care by those who need care type of thing. So about 10% of premature deaths are preventable with medical treatment alone, while 70% are preventable through population-wide public health approaches. For example, smoking prevention and cessation programs have greater potential for preventing lung cancer than medical treatment. Additionally, one effective strategy is to prevent contracting rabies is by vaccinating pets, creating a barrier between common carriers of the disease and humans. So we have, again, the public health part coming into picture. The US Constitution does not mention a federal or state role in healthcare delivery. Public health intervention is based on interpreting the general welfare provision in the preamble and the interstate commerce clause. The general welfare provision, to promote the general welfare of its citizens, is interpreted to include healthcare. The interstate commerce clause is used to justify federal regulation of entities and processes crossing state boundaries like air, water, and sanitation. The federal government primarily funds public health strategies. The Department of Health and Human Services, DHHS, doesn't mandate specific public health interventions, but guides strategies through fund distribution to state and local governments. The federal government also has direct control over environmental issues through Environmental Protection Agency. State governments also fund public health, often matching federal funds and distributing the total to local areas for services. They establish public health standards and regulations. Local governments, particularly health departments, play a direct role in public health. They interact with citizens at the county, city, town, borough, and village levels. Before modern technology, our knowledge of the environment came from our senses. For example, doctors recognized diabetes mellitus by the sweet taste of the urine, or the microscope-enabled study of infectious diseases and their causes, and things like that. Public health strategies date back to early civilization. One remarkable aspect is its success despite unknown root causes. So let us look at the highlights of public health in America. In 1639, first US public health law enacted in Massachusetts required recording of all births and deaths. In 1798, Marine Hospital Service was established, where President John Adams signed a law for care of sick and disabled seamen. aimed to provide the valuable health of sailors for the shipping industry and to prevent spread of diseases to port cities. In 1862, founding of Bureau of Chemistry in the Department of Agriculture, this is the forerunner of the Food and Drug Administration, FDA, which is here today. 1865, Shattuck Report, published in New York's City Council of Hygiene and Public Health, exposed unsanitary city conditions, led to the passage of Public Health Law creating a City Board of Health. This law was able to first establish an administrative structure for local public health affairs. In 1870, Marine Hospital Service reorganized as National Hospital System. The surgeon in charge later became Surgeon General. In 1902, the name changed to Public Health and Marine Hospital Service, and in 1912, it was renamed the United States Public Health Service, which continues today. 1887, the first public laboratory for studying disease opened in Staten Island, New York, precursor to the National Institute of Health, which is today. 1930, creation of National Institute of Health became National Institute of Health. In 1933, Federal Emergency Relief Act was released. The act provided federal aids to states authorizing medical care for acute and chronic disease illnesses, obstetrical services, emergency dental extractions, bedside nursing, drugs, and medical supplies. Not all states participated in that. 1935, Social Security Act of 1935 gave the Public Health Service authority to assist states, counties, and health districts in maintaining public health services. In 1939, creation of the Federal Health Agency was done. The President Roosevelt consolidated health, welfare, and education service programs into a federal health agency. Public health was removed from the Treasury Department and the Federal Security Agency was created, consolidating health, education, and welfare services. Emerson Report. According to the Emerson Report, 6 tasks of public health still prevail today, which is actually it is still existing today from the Emerson Report. Vital statistics, identifying trends in births, deaths, marriages, divorces, morbidity, and other statistics. Then the communicable disease control, establishing immunization programs, school entry requirements, behavior modification strategies, and administering CDC reportable disease programs all comes under communicable disease control. What is sanitation is ensuring proper disposal of sewage and purity of water, air, and food. Laboratory services, testing water, air, and food quality. Testing for diseases or pathogens with possible or potential public health consequences. Maternal and child health, providing appropriate prenatal care, nutrition for newborns, well baby care, and immunizations. Health education, providing information on obtaining services. Counseling for nutrition, smoking dangers or cessation, personal hygiene, and exercise. This is just education. One additional task which is not listed here is providing outpatient care to the poor individuals in clinics. In 1946, Federal Security Agency adds other public health agencies, added the Children's Bureau and the Food and Drug Administration. 1946, the founding of the Center for Disease and Control and Prevention, CDC, originally named the Communicable Disease Center. 1953 is the creation of Department of Public Health, Education and Welfare. President Eisenhower created the Department of Health, Education and Welfare, HEQ, as cabinet level position. 1964, first Surgeon General's report on smoking and health published. 1970, National Health Service Corps formed. Congress and President established National Health Services Corps to offset the maldistribution of providers by financially rewarding prospective clinicians for their willingness to practice in needy areas. And in 1980, the Department of Health and Human Services formed. After education was separated into its own cabinet-level department, HEU became the Department of Health and Human Services. Some notable public health agencies include Department of Health and Human Services, DHHS, which includes the National Institute of Health, Center for Disease Control and Prevention, CDC, and Food and Drug Administration, FDA. state departments of health, World Health Organization, Environmental Protection Agency, and many others are also significant in the public health agency sector or public health agency under public health agencies. So here we discussed about more about public health agencies and public health services. I hope you can go through the textbook. Again, all these lectures are just a part of the textbook, that it will not replace the textbook. You need to read the textbook, and then maybe this will help you to remember the major points. Most importantly, keep smiling. This is Dr. V signing off. Thank you.